Facebook Live / Instagram / YouTube Q&A with JJ Staiano, this guy here, plastic surgeon to the stars. If you've got any questions, then feel free to ask me live and direct. If you haven't got any questions, feel free to see the questions that other people have asked that I shall be answering presently. So let's get this show on the road, and let me begin with a question that I have been given, which I have got right here. Question goes a little bit something like this. Sometimes I look at these questions and I look at the questions, a little bit before the broadcast, and I do think I should have done a bit of research about the answer to the question prior to coming on here. But, it is what it is. We're here now. Otherwise, it just never gets done. So, look on the bright side. I'm here. But I do regret not doing a bit more research on this question. But anyway, I'm going to do my best. So the question goes something like this. Do you have any surgeons who specialize in relatively non-invasive stitch otoplasty or ear stitch technique? So in general terms, I'll answer this because there's different ways of doing otoplasty. I'm not entirely sure what they're talking about when they're saying relatively non-invasive stitch otoplasty, because there are some techniques, for instance, in facelifts, where they just put a subcutaneous just underneath the skin. They'll put a stitch to lift the face, and that's not less invasive than making a cut. I'm not aware of any techniques of otoplasty, which is basically reshaping the ear, where they have this sort of less invasive method, apart from the ear fold, of course, which is the little metal clip thing. But I don't know of any sort of less invasive stitch techniques. And having said that, there are stitch techniques, basically an otoplasty, reshaping the cartilage of the ear. There's broadly speaking two techniques to do an otoplasty. One technique is to reshape the cartilage, and you reshape the cartilage by scoring the cartilage. So you've got a piece of cartilage like that, and you score it. Now, the problem with that is that when you score it, if you get a piece of cardboard or something like that, and you score it, the cartilage will bend away from the scores. I should have done it like that because my hand doesn't bend that way, but it bends away. So if I do it like this, so if you do scores like that, it bends away from the scores. So the scores sort of open up and the cartilage bends away from the scores. So when you have a prominent ear, you want the cartilage to bend backwards. So you want to score the cartilage on the front. So it's called an anterior scoring technique. So you need to score the cartilage on the front, but we don't want to give you a scar on the front. So we give you a scar on the back. So we make a scar on the back and we deglove the ear. So you have to make a cut through the cartilage, full thickness, but not going through the skin at the front of the ear. And then you peel the skin off the anterior cartilage, and then you score it to make it bend back, and then you stitch up the skin. That's probably the most common technique of doing ear otoplasty. The other technique is by putting stitches in the cartilage. So in that respect, it is a less invasive because you don't have to deglove the ear. You don't have to get to the front of the cartilage. You put stitches in the back of the cartilage, and you put stitches cartilage to cartilage to bend, to bend it like that. And then you can also do cartilage to mastoid being that bit of bone there, to sort of pull the whole ear back. And I think that's what they're talking about, where they're talking about the ear stitch technique. I don't really do this anymore. I used to do it, and I have done both techniques. I tend to move back towards the anterior scoring because I can get more predictable results with it. Although I understand a lot of people, well, not a lot of people, but some people who are particularly doing a lot of ears are moving towards the stitch technique because there's less complications associated with it. Because actually, I think this question said about the head bandage and things, because you have to wear a head bandage and thing after an ear correction. But when you're doing the stitch technique, because you're not, degloving the ear so much, there are less risks, less complications associated with the ear stitch technique. Anytime anyone tries to tell you one technique is better, like I've just said there's less risk and complications associated with the ear stitch technique. So what you should instantly be thinking is, why would anyone do the anterior scoring technique? Well, the reason is that the ear stitch technique relies on those stitches. So if at any time those stitches break or come undone, the ear will go back again. the stitches, you've got to be very careful because there's not a whole lot of soft tissue cover there. You've got to be very careful you don't feel the knots or feel the stitches, because if you can feel the knots, you're always going to be able to feel the knots. And you've got to be very careful of getting wound healing problems, because if you get a wound healing problem, because often we use permanent sutures. So it's one of the very few areas where, I mean, it's personal what suture you use, but it's one of the very few areas where you use a permanent braided suture. So a braided suture is like a shoelace as opposed to a monofilament suture. So there's two types of sutures, braided and monofilament. Those are the two sort of structures of suture. So monofilament is like a fishing line, braided is like a shoelace or a rope that you'd tie a ship up with. And the good thing about the braided ones is they grip a lot better. There's a lot more friction with a braided suture. Like if you try and tie your shoelaces with a shoelace, it grips. Where if you try to do it with a fishing line, you try and tighten it and then you let go and the tension would go. So the braided sutures are much better at gripping. That's why, and so adjusting the tension is easier with a braided suture. The problem with a braided suture is because it's like a shoelace, you get little bits potential for infection. Basically, there's more risk of infection with a braided suture compared to a monofilament. And so if you do get an infection in a braided suture, particularly, as I say, I use a braided permanent suture. So if you get an infection in the sutures that you're using behind the ear, you have to remove that suture, and then obviously you've lost the control of the shape of the ear. So there are risks with both of them, but basically there's risks with using sutures and with using the anterior scoring technique. And it is up to the surgeon. The reason at the beginning I said I should have done a bit of research is because I don't know. So Kuram is the main guy who does this. I don't know if he does the stitch technique. I don't know if he favors one or will do one in certain circumstances. So the essence that requires an answer in this question I haven't got, because I don't know if we've got any surgeons who do the stitch technique. But I thought, there you go. But anyway, that's what the stitch technique is compared to the anterior scoring technique. So a little bit of background there on the different types of ear reshaping surgery, or otoplasty, or pinoplasty, same thing. So yeah. So that's it. Khan's in the house. Good to see you, Khan. Nice to see you here this evening. Hope you're well. Know what that is. There you go. Good to see you. This is a comment, and I think I'm understanding it correctly. It was a comment that I got on YouTube saying, I want a breast reduction. Can you just remove them? That would be great, or something like that. It said. So I think what it's saying is, can you just remove the breast? I think that's how I read it. Can you just remove them? And it's not uncommon for people, both men and women actually. Actually, it normally comes from men, this, who've got gynecomastia, excess breast tissue. That they just say, look, I want them gone. I don't want them, I just don't want breasts, basically. And what they're asking for is the equivalent of a mastectomy that you would do for cancer. So obviously with a mastectomy, you'd remove the whole breast. But it is really not. I can completely understand it, and I don't think this person meant the question in the literally, but I will sort of answer it literally, that you would not, or at least I would not remove a breast for a breast reduction, because if you don't have anything there at all, again, this goes for men and women, it can give an abnormal shape to the chest and the torso. When you do a mastectomy on someone who has had breast cancer, when you do remove all of the breast tissue, there is almost a concavity, but there's a definite flattening of the chest. It is not a normal chest contour. So it is important to try and maintain a normal chest contour, and that's mainly for a man. And for a woman, you want to have a bit of tissue there. I completely understand how they can be too large and cumbersome and uncomfortable and cause symptoms and cause all sorts of problems. But really, the answer is not to do a mastectomy. I think what you're probably asking there is for a bigger breast reduction. And if you really want if you've got really, really big breasts, and this is something we'd have to see you in the clinic to examine you, and you want them to be sort of as small as possible, then you're going down the route of a free nipple graft where you take the nipple off and you put it back on, which has potential complications with taking the nipple off, but it does mean that you can make the breast smaller because you don't have that pedicle, that stalk of tissue that goes to the nipple. So free nipple graft would probably be more what I would be thinking of in someone who's saying, can you just remove the breast? But I wouldn't do a formal mastectomy. Obviously, if it's sort of gender reassignment when female to male, you're looking at removing the breast, but that is a specialist area, which is not something that I do. So you'd have to be referred to someone who specializes in that sort of procedure and works in a multidisciplinary team. But for a female requesting a breast reduction, no, I wouldn't remove the breast per se, but I would talk to you about what sort of reduction could be achieved, and I would always aim to leave breast tissue there and give a shape that's in keeping with your frame. And one of the big things, I guess, about any surgery, in particularly this sort of surgery, is very subjective, and it is trying to get aligned with patients, both from my point of view and from your point of view as a patient. You need to see if the surgeon's aligned with you, and if you think the surgeon's not aligned with you, for instance, if this patient comes to see me and I say, look, I'm not going to do a mastectomy, etc., for all these reasons, and they think, hold on a minute, I'm the patient, I'm going to, request what I want. Fair enough, but I'm maybe not your surgeon then. Maybe we're not aligned then. Maybe you can find a surgeon who is more aligned with you. And I think it is quite subjective, a lot of these things and a lot of these questions about doing certain techniques and certain ways of doing surgeries. And we all have our own views about how we do them and what sort of results we want to achieve. And I will obviously try and give the patient the result they want. And I will show them some results of some of my cases and give them my view on what an aesthetically pleasing chest looks like. But if that is not your view, or if that is not their view, then maybe another surgeon's a good fit. I've changed a bit in my time, because sometimes I show photos of things, maybe tummy tucks or whatever, to be honest with you, breast reduction, anything, and people will look at them and go, oh my God, look at those scars, my Lord alive. And I think there was a time when I'd be like, yeah, but they're quite early, those scars, and they're a bit red, normally they're not quite as bad as that. I'm not like that anymore. I'm like, yeah, those are the scars, those are the scars. Those are real cases that I'm showing. I try and show a spectrum of cases rather than just sort of showcasing the best cases I've ever had in my life. That will be a highway to unhappiness if you just show patients all your best cases. So I try and show my a spectrum of realistic cases. And if you look at them and say, look at those scars, look at that shape, I don't think that breast proportion looks good. I don't think that's a very good result. Maybe you might think, I'd be like, yeah, okay, well, that is a real result, and that patient's happy. She's letting me show you her photos, and I'm happy to show you her photos. So if you don't think that's a good result, then that's the sort of results that I get. So try, because I'm all about trying to get a happy patient, and sometimes I don't align with patients, and my expectations don't align with their expectations, and I'd rather actually not operate in those situations. I'd rather not operate and have an unhappy patient who I haven't operated on than operate on someone and have an unhappy patient. That's it's better to have not to have an unhappy patient at all, obviously, so try and avoid the unhappiness. Who's I mean, the question about breast reduction, how do we get onto this anyway? That's my ethos, that's a bit about me anyway, rambling away. Amy Summer Bonnie is in the house. Amy Summer Bonnie, how are you? I hope you're well. I'm looking forward to seeing you, and good to see you. Corinne is in the house, and Corinne is counting down the days till December the 20th. I've got it on my wall, Corinne, and I'm counting down the days, honestly. December the 20th. Yeah, absolutely. Big day. This is a weird one. Why they put this question here? Answer this on a postcard, please. Do we remove moles located on the back of the ear? What kind of question is that? Am I missing something? Moles located? Well, yes. Yeah. Essentially, we will remove moles on any part of the body. I think I can safely say that. We will remove moles on any part of the body. Right, where would we not? Well, maybe on your eyeball. If you had a bit of pigmentation on your eyeball, wouldn't do that. Yeah, anywhere. I mean, sort of anus, vagina, maybe. Vagina, not so much. Anus, if you worry about the sphincter and things. But to be honest with you, anywhere. Because you can get moles, you can get melanomas, you can get, problem moles in any part, any bit of skin. So we will remove them anywhere. So back of the ear is a no-brainer. Back of the ear is a defo. I'm not quite sure why we wouldn't remove moles. I'd like to ask this person, unless I'm missing something. And also we'll remove moles of any size. I don't, when you're, plastic, there's a lot of people who remove moles, dermatologists, GPs. I'm not sure if GPs do it so much these days, but certainly there's a lot of sort of doctors who will remove moles. But when they get really big and there's a problem, who do they call? They call this guy. Oh, well, maybe not me, but the plastic surgeons. So basically, we can remove moles of any size in any location. I think I can safely say, except the eyeball. I'm going to put the eyeball as a disclaimer, a little star by that. But I challenge you to think of an area that we would not remove a mole. Back of the ear is an easy one. Maybe I should get them to make. I should put the question, shouldn't I? Do we remove moles on the eyeball? I mean, that would be a good question. That'd be a no. I'm not saying it's not a good question. Obviously. Elaine Hartland, hello. Good to see you here tonight. Your hair's looking good. Amy is in the YouTube. Good to see you, Amy. And then Amy, God, we got a quite popular Amy. We should do marketing to Amy's because Amy's quite a special plastic surgeon with a special interest in Amy. Not too bad, thanks. That's even nice to see you soon. Good to hear, Amy. Good to hear. I've seen your photos, looking great. Elaine, hello. Looking forward to meeting you in person next Wednesday. I'm very much looking forward to that as well. Elaine, very much looking forward to that. Seeing that pink hair next Wednesday. So yeah, obviously we remove moles on the back of the ear, guys. What about this one? Do we offer steroid injections to the under 18s? So the answer is no. And the reason it's a no is simply because we are not allowed to treat people who are under 18. There's nothing wrong with doing steroid injections to people who are under 18. So steroid injections are for lumpy, hypertrophic / keloid scars. So that's why we would do steroid injections, and they're for ugly, lumpy scars. So it is fine to do steroid injections in people who are under 18, but we are just simply, the CQC have just said, you can't see anyone under 18. And these days, I see all my patients at my clinic. I don't see them in the hospital anymore. If I saw them in the hospital, actually in the hospital, I probably wouldn't be able to, actually thinking about it, because I don't treat under, you have to be a pediatric plastic surgeon. So Kurum is a pediatric plastic surgeon. Vicky is a pediatric plastic surgery nurse, but the clinic is not sort of box ticked for children. We just the bureaucracy was too great. I'm sorry to say, and the number of children we treat is very small anyway. So I'm terribly sorry that if you need a steroid injection, if you have a mole that you don't like, or ears often is with children. We just unfortunately can't treat them. And you know what? The hospitals are finding it difficult as well. There's so much bureaucracy, and it is a shame really, because 15, 16, 17-year-olds, you know what they're like. They're huge, but they're still classed as children. So yeah, we can't treat anyone under 18. So yeah, it's a no for that one. Sorry about that. Do we offer liposuction on the neck, double chin? I don't know if the regular listeners will have anything to say about this, but has this question, is it me, or has this question appeared in like the last two lives? I don't know, maybe it has, but anyway, no, we don't. It is a good place for liposuction, Miss Harry. It's a good place for liposuction, but don't really do facial stuff. Do moles, as I said, moles at the back of the ear and other parts of the face, but don't really do no liposuction to the neck. But as I say, it is a good place to do liposuction. Is it possible to place an expander? For an expander to be placed to make it easier for that tattoo to be removed? This is someone on YouTube who has commented on one of my videos, who is the preface to this question was that she's saying, I think it's just above her ankle, tattoo above the ankle, bad place for a bad place for a scar, because the skin is tight, there's not much bare skin. And so when the skin is tight, when you have a big thing, be it a tattoo, be it a scar, be it a mole, a birthmark, whatever it is, if you've got a big thing that we can't cut out and stitch together, if it is too tight to cut out and stitch together in one go, we got three options. Broadly speaking, three options. One option is to import a bit of skin. So if it has to go straight away, so if it's a cancer, for instance, and it has to go, there's no question, we've got to get rid of this, and we've got a big hole there that we've got to fill. So that comes into the reconstructive world of plastic surgery, where you often have big holes that you've got to fill. And so then you've got to import skin, and that can be either be done with a skin graft, which is taking a piece of skin off and putting it back on again, or it can be done with a flap, which is making a piece of skin nearby attached and moving it across, sort of broadly speaking. For cosmetic reasons, for scar revisions, for moles and birthmarks and tattoos and things, I wouldn't do any skin importation procedures. I wouldn't do any skin grafts, and I wouldn't do any flaps, because they look unsightly. They do not look as good as the normal skin that was there. So that is out in my book. I do not do skin grafts or flaps for these things, which are elective things. They don't have to go in one go. You can take them off in pieces. So if you're not going to do so, that's option one. So that's out in my repertoire. Although, as I say, there are plastic surgeons out there who might do it, but that sort of thing. But in my view, they look worse than the thing you had. So that leaves us with two options. And the two options are utilizing something of the skin, property of the skin, which means when you put the skin under tension, more skin grows. It's called the stress relaxation phenomenon. And what that means is when you put the skin under stress, when you make it tight, more skin grows. That is the concept of pregnancy. So if you were to try and put a full-term fetus inside the abdomen of a woman, who's straight away sort of thing, it would no way fit. The only way it fits is because it gradually grows over 9 months. So that's how it fits in there, because what happens is it grows a little bit, stretches just a little bit of the skin gets under tension and it's tight, but then after a while more skin grows. And so it goes, all right, that's no longer under tension. And then a little bit more tension as the fetus grows a bit more tension, bit more tension. So then by term fetus, you've got more skin there than you had before. And that's the reason why people need a tummy tuck, because you deliver the fetus and you've got too much skin there. Like, where the hell will that skin come from? But anyway, that's the stress relaxation phenomenon. And there's two ways you can utilize that if you want to remove a big thing that you can't cut out in one go. The first way you can utilize that is do something called tissue expansion, which is what this patient is asking about. And tissue expansion is equivalent of like what the fetus does. So you put an empty plastic bag in, basically, next to the area. So if you have in this example, a tattoo, so next to the tattoo onto normal skin, you put an empty plastic bag, and the plastic bag has a little valve, and that you can percutaneous through the skin. You can stick a needle into the valve and blow it up. So you put it in and you blow it up a little bit, and you don't blow it up too much because it's sort of going to be a bit tight. And then you say, look, come back in a couple of weeks once the wound's all healed. Because you have to make a cut to put it in. Come back in a couple of weeks, and I am going to blow it up a bit more. And you put a needle in just in the clinic through the skin to find this port, put it in, blow it up, and you go, oh crikey, that's enough. Oh, that feels really tight. So you go, okay, that's enough. Come back in a week or 2 weeks. It depends on how, you can do it in a week or 2 weeks. Come back. You come back in 2 weeks. Oh, it's not tight anymore. Remember when you did it? It was really tight. It's not tight anymore. So you inject a bit more saline. Oh, it's tight now. 2 weeks. Inject more. Oh, it's tight now. And it gradually expands. Same as what a fetus does. And then by the end of the time, you've got this big plastic bag underneath your skin. I've taken the liberty of going onto the internet and showing you and finding it. Oh, damn it. I should have put it on Instagram. Damn it. Sorry, Instagram. So this is it. This is oh, damn, that's bad of me, isn't it? Sorry. Anyway, it's basically a picture of a big bag on someone's arm with a sort of scar next to it and a big bag underneath the skin. So that is the concept of tissue expansion. You put a bag in and you gradually lower it up, and it relies on the stress relaxation phenomenon. I don't do this on the limbs. There's a few areas where it works well. The breast, it works really well. So for breast reconstruction, it's a technique we use. Put an empty plastic, do a mastectomy, close out the skin. It's all tight because you've taken all the skin out. Then years later, if you want a reconstruction, you can put a bag in underneath the skin and then gradually blow it up to stretch the skin. So tissue expander works well there. Often in the scalp, road trip accident, lose a lot of your hair-bearing area in the skin, or if you've got cancer or something, you can put a big tissue expander in that hair-bearing area and blow it up. And then you've got extra skin that then you can take the tissue expander out, and then got loads of floppy skin that then you can use to reconstruct the defect that you make when you cut the scar or whatever it is out. So I don't do it on the limbs. So the reason I don't do it on limbs is because it has got a high complication rate. Tissue expander's got a high complication rate. They're unwieldy, they're unsightly. It is good because it's only 2 operations. Because only one to put it in and then one to take it out. It's difficult to reconstruct. There's never quite as much skin as you think you've got. You've got this massive expander and you take it out. You've never got quite as much skin as you think you got. So it's fraught with difficulties for doing it on the limbs. So personally, I don't really do it on the limbs. And I don't really do it for these sorts of indications for tattoos, etc. What I do is the same concept, but the other way around, if you can get your head around this. So I don't know if anyone's still with me. I don't know if I've lost the audience, but anyway, I'm going to push on. So the concept is you've got a big tattoo. You cut as much of it out as you can. You stitch it up. It's really tight. You're like, oh my God, that's really tight, man. That's so tight. And then you come back in to be honest, I leave it 3 or 4 months, not a couple of weeks, because you need to get that wound to heal. So it's a bit different because you've got to get the wound to heal. So you leave it 3 or 4 months and it's no longer tight. And then you can cut another bit out. Leave it 3 or 4 months, then you can cut that big out. So that's called serial excision. So it's the same principle as tissue expansion, but the other way around. You're cutting out a bit at a time rather than putting a big bag in and stretching out the skin. And it is my preferred technique for doing big tattoos. So this tattoo on the leg might be appropriate for serial excision, but personally, I wouldn't use a tissue expander. Personally, I don't use them on the limbs. I think it's quite well regarded amongst plastic surgeons that tissue expansion on the limbs, it has got quite a high complication rate, and I don't think many people will embrace it, but you might find someone who does. I don't know, who knows. That picture's there. So, someone's obviously drawn a picture of it. So there you go. Yeah. So that's my view about tissue expanders. Amy Jade, what you got to say? Can you cut around the natural shaped areola? Do you aim for a neat surround circle for a reason, or is it just what others usually want? Have I missed something, Amy? What are we talking about here? We're talking about breast lifts and stuff. Can you cut around the natural shaped areola? Yes, you can. Do you aim for a neat circle for a reason? Yeah. So I'm going to run with this, Amy. Stop me if I'm going down the wrong line. So when you're doing surgery on the breast, you often relocate the areola for a breast reduction and a breast lift. So yes, you cut around the areola, and you always cut it circular because the perception is the areola is round. So the reason for it is what people want, and you can specify the dimensions if you want. Sometimes people want it smaller. 4 centimeters is sort of normal for an areola, but I wouldn't do it less than 3, but 3.5, 4 centimeters is sort of normal. And I always say to people, it never ends up round. So even if you aim for it to be round, it's a nice round, neat circle, but to be honest with you, pretty much usually ends up a bit oblong. But if you look at areolas, they usually are a bit oblong. They're a bit wider in one dimension than the other. They're not quite perfectly round. But not sure where you're going there, Amy. Do you not want a round one? Is that what you're saying? Or Anyway, yeah, but you aim for it to be round, but sometimes it doesn't end up round. Is lymphatic drainage massage treatment suitable after having a full abdominoplasty? Now, people do talk about this, and to be honest with you, I'm going to be honest with you now. I am constantly looking for ways to improve the service that I give to patients. And lymphatic drainage, Jackie's here, lymphatic drainage is something that does come up from time to time, but it is not something that I have particularly embraced or that I particularly recommend. I'd be interested to hear if anyone is out there who has got a view about that, about whether lymphatic drainage is a good thing or not after abdominoplasty. I would be very interested to hear their view on that, because I haven't got a strong view, so I don't particularly talk to people about it. However, if someone specifically asks me, is it suitable? So that question, is it suitable? Yes, it is suitable. And people do talk about it. And I would imagine it'd be quite nice having massage and having some attention, put on you. Whether it is, it is beneficial, I don't know. So I don't know what the benefits are, or if there are significant benefits in having lymphatic drainage after a full abdominoplasty. But certainly, if you want to try it and you therefore feel that it's beneficial, fine. I'm not sure. I don't think there's much harm that can come from it, as long as they're gentle and your wounds have all healed properly. Obviously, you don't want to have sort of issues with that, but certainly it is suitable, and it is things that people talk about, but not something I particularly recommend. Not because I don't recommend it, not because I'm negative about it, but just because I don't know enough about it. So it's not that I neither think it's good or bad. I would really need to look into it to see whether it's a good thing or not. But I'd be interested to know if anyone's got any views about it, good or bad. But I haven't really got any views about it myself. But yeah, people do tend to talk about it, don't they? Amy J's back at me. When having an uplift, yes. So an uplift, yeah. I wondered. I'm wanting an uplift, but I like the natural shape of my nipples, if that makes sense. So Amy, let's just get a bit of I want to say bookkeeping. It's not bookkeeping. Housekeeping. Bit of housekeeping. That's the word. Bit of housekeeping now, Amy. Just to be clear, the nipple is the bit in the middle, the bit that sticks out in the middle. So the areola is the bit around the outside. So and altogether, it's called the nipple areola complex, NAC. So yeah, if you like so yes, you could cut round your natural nipple. Yes, you could cut round your natural nipple, keep it the same size as what it is. So you can keep it the same size or smaller. You can't really make it bigger, but you can you can tattoo it if you want to make it bigger. But keep it the same size or smaller. But if you're having an uplift, Amy, I would not be able to guarantee that it would look exactly the same size and shape, because scarring is unpredictable, how the scarring settles and fades. But could certainly cut it the same as what it is now. But I would probably end up cutting it. They're normally sort of circular, but yeah, certainly size-wise could be the same size. That's what it is now. Gastric is in on Instagram with a question. Can always rely on Gastric. Fantastic. Hashtag, and not only that, hashtag ask JJ. Now the party started. Right. Why can't a size 24 just cut the fat off? Why can't a size 24 just cut the fat off? Gastric, I do salute you in many ways. You've used a hashtag, you've asked a question, you've ticked loads of boxes there. Not fully understanding the question, to be quite, why can't size 24, so size 24, someone who's big, just cut the fat off? Like a tummy tuck you're talking about here? So basically, when you do surgery, Gastric, you got to do surgery localized to an area. A lot of people say, if I win the lottery, I will, have plastic surgery. You're like, well, what? I've won the lottery. What can you do? So someone who's, for instance, to go to a size 13, okay, someone who's a size 24 comes and sees me and says, I'm a size 24, I want to be a size 13. I'm like, right, okay, well, you need to lose weight. They're like, yeah, but I've just won the lottery and I want to have surgery. Well, what surgery do you want? Well, cut all the fat off. That ain't going to work, Gastric. That ain't going to work. You can't just sort of shave. It's not like a clay sculpture that you can sort of shave the fat off the outside in layers and make it smaller. You have to take localized area of fat and skin off. And plastic surgery, body shaping surgery, is really for people who have lost weight. It is not a weight loss procedure. Why? Because if you do, for instance, a tummy tuck, let's take an example, a classic example. The abdomen's often a problem for someone who's, for instance, a size 24 or whatever, or big. So if you do a tummy tuck or an apronectomy, you get rid of that apron, you take that apron off, you cut that overhanging bit of skin off. There is still skin left behind in the subcutaneous layers, on the back, on the upper abdomen, and these people still look overweight because the legs, the thighs, the arms, if there is a thick subcutaneous layer of fat all over the body, they will still lose weight. You can localize, you can address areas, you can reduce the breast, you can reduce the abdomen, you can take a bit off the arm, but you still got fat in the rest of the area that's left behind. So you can't really sort of liposuck the whole body down and just suck it all down and then cut skin out. It is the way to lose weight is to lose weight, or to look at gastric bariatric surgery, to lose your body weight, to globally all over your body, to lose that fat. You can't. Plastic surgery is not. Yeah, even if you had the money, it is not appropriate. And I've seen people like this who have got the money, who are business people, who are busy and their lives are busy, and they can't lose weight. They can't, or at least you just say that it's never going to happen. I'm not going to lose weight, and I'm like, well, I can't help you, because I can do a tummy tuck on you. I can take that abdomen off, but you're going to have a bit of skin off the abdomen. You're still going to be Douglas, you do need that. Definitely, you do need that. But no, these people, they need to see a bariatric surgeon. They need to globally lose weight, lose the fat globally, and then a plastic surgeon or a body contouring surgeon will be able to contour areas of the body that are resistant. And there are certain areas which are resistant: abdomen, breasts, arms, thighs. Comes up time and time again. But if you do one of these operations on someone who's overweight, first of all, they're going to have a higher risk of complications when you operate on people that are overweight, but also they're going to get a worse result because they're still going to look overweight, because all you've done is cut a bit of the fat off their tummy, a localized area of fat. You've left behind the fat in the rest of all around the back, all around the sides, everywhere. There'll be a thick subcutaneous layer of fat, and so they need to lose weight first. So hypothetically, millionaire, size 24, comes and says, I want to be a size 13, and here's a stack of used notes. I'm really sorry. I'm going to be turning you away, my friend. I can't help you. And I've had that, and I've had people like that, and I just cannot help you. I need you to have lost the weight first and say, this skin's giving me grief, or this bit of fat on my hips isn't going, or this is resistant to weight loss. Is for once you've lost weight. It is not a weight loss procedure. So anyone who says, when I win the lottery, I'm going to have liposuction, it's nonsense, absolute nonsense. Liposuction is for areas that are not responding to weight loss. When you win but I don't care, I'm sure a size 12 now. When you win the lottery, go and see a bariatric surgeon if it's weight loss you need, or a GP to help with weight loss. I don't know. Weight loss is a whole area in itself, but it's not a contouring surgeon. The surgery comes once people have lost weight. It is not a weight loss thing. The sort of surgery I do, the contouring surgery, it is thankless doing it on overweight people. I mean, 32 is not bad, Gastric. So when you come to see a plastic surgeon, if you want if you want something done, you have to be specific about what you want done. So if you went to see a plastic surgeon and you said, I'm overweight and I don't want to be overweight anymore, I want to be thin, you'd probably get turned away at the door. It is not how we look at. No way. From 59 to 32. Was Douglas, this is why you are the best. Douglas says that to everyone. You say that to everyone, Douglas, I know it. I mean, that's crazy, Gastric. But, well, then that's excellent. So then you're probably a very good candidate for body contouring surgery, I would have thought, Gastric. 59 to 32 is a absolutely ridiculous amount of weight loss. And I suspect there are areas that you would like to be tight, where the skin would like to be tightened. So that's what we're talking about here, tightening skin, not losing weight. If you want to lose weight first. So, you know, if you're being almost 32, you've gone from 59, that's ridiculous. You know, that's a huge congratulations on that. But if you are not happy with your BMI being 32 and you want your BMI to be lower, don't go and see a plastic surgeon. Go and see someone who helps with weight loss. Once you've got your weight down, once you're stable with your weight, that's when you want to look at your plastic surgery options to tighten skin and to contour certain areas that have got redundant skin left behind from the weight loss or redundant pockets of fat. That is what the surgery does. It does not make you lose weight. You will not lose weight with plastic surgery. You will only have body contouring and for certain localized areas. Very good, Gastric. Good question. Good concept. I hope I've got that across there, because it is not uncommon. Well, it is actually uncommon, but sometimes it is uncommon. But sometimes people do come and say, "Oh, I just want to have something done. I don't want to go to the gym. You know, can't be bothered. Can't you just do a bit of lipo?" And you're like, "What?" Well, all this, you know, just this my tummy and all this. It's a Simon, but I cannot strengthen my tummy for M. For M? Yeah, well, it's not a question of strengthening your tummy. You probably can strengthen your tummy, Gastric, but BMI 59, your muscles are probably splayed apart. So you've got the muscles there, but your muscles are probably lax and splayed apart. And again, plastic surgeon is not going to be able to strengthen your muscles either, to be fair. I guess a plastic surgeon will be able to bring them together and to let you see what muscles you've got there, but we won't be able to strengthen those muscles. All we can do is bring them together and make the shape of your abdominal musculature more in keeping with how it was previously, and then obviously take off that excess skin on the front of the abdomen so that you can then see the abdominal contour better, but we can't give you stronger muscles. We just will be able to you know, reveal what's already there. Yeah. ADKJJ. Use the hashtag ADKJJ, okay? ADKJJ. Thanks, Gastric. Thanks for the question, Gastric. Good question. Yeah, that was a good one, wasn't it? I knew that. Amy knew that, or Amy knew. Amy knew something. ADKJJ yourself, ADK Gastric, okay? Let's get that trending. Now we've got the ADKJJ trending. We should get ADK Gastric. Fantastic. So, let's go on there. Let's go on. What procedures, now hashtag last question, what procedures do we offer to remove seborrheic keratosis? What's that? What's a seborrheic keratosis to say? Do you know what? I feel I'm a bad man because I got it on Facebook, but I haven't got it on it. Oh God, is that too much? What's a seborrheic keratosis? Oh, that's a seborrheic keratosis right there. Okay. Sorry, you can't see it. Basically, the seborrheic keratosis is like a mole, essentially, with often dry skin, often have what's called a stuck-on appearance. They come as you get older. You can have them. You can get multiple. They're benign, nothing to worry about. And there's several ways to remove them. Because they're benign, there are a variety of ways to removing them. I'm showing one on the screen on Facebook, and the one on the screen on Facebook has got a central area which is sort of seborrheic, and then it's got a bit of a mole around it. The area is a little bit indistinct. The pigment's a little bit irregular. I was a little bit worried about this one, so I actually cut this one out so that I could send it away for histology. So obviously you can cut them out like I did with this one, and that will leave you with a linear scar. Now, if you've got multiple, or if you don't want to have a linear scar, then there are other ways you can do it. So you can shave them off. You can curette them off. Curettage and cautery. Cautery is the like burning the blood vessels. So you can scrape them off. So dermatologists often do this. Just scrape them. Basically, it's just taking that top layer of the skin off. Did I say shave? So whatever you do is just sort of scraping the top layer of the skin away. Sometimes people will burn them with a laser. You can cool them with a liquid nitrogen. So just damaging that bit of skin to take that top layer of skin to get that dark patch and the dry scaly patch off. So there are multiple ways of doing it. So the question is, what procedure do we offer? So I do mainly / only excisional stuff. So I do stuff with a knife. So I would shave it, or I would cut it out. Things like cryotherapy with the freezing, well, the dermatologists will do a lot more of the non-surgical type stuff, freezing, laser, curettage. Dermatologists will be able to do that sort of things, which are probably better for multiple. So if you've got a lot of multiple seborrheic keratosis, probably better to see a dermatologist. If you've just got one or two, and if you're worried about them, if they're changing, if they're bleeding, if they're itching, if there's any concern there might be cancer, then it might be best to cut it off, which is something that we would do in our place. But so cutting and shaving is what we would tend to do. But there are several other options available. So that is it. I can hear in the back of my ear, Bake Off is next door, I think. So I think I'm going to go and see what's going on there. But not that I'm not a big fan. It's just the family like it. So. I want to make out that I do like it, because I don't like it that much. But it's just nice to sit down, isn't it? So I'm going to go and watch a bit of TV. But if you've got any questions, I'm open. But Gastric and Douglas, thank you very much. Amy, you're a legend. You're a YouTube legend. I hope you know that. And everyone else who knows me. Thank you, Corinne, Elaine, other Amy on Facebook, Khan, anyone else who has anything. I'm going to check out.